My name is Tamara Sunbul. I'm a physician by background, and I play the role of a CMIO here at Johns Hopkins Aramco Healthcare. We're launching our enterprise data warehouse that we hopefully will revolutionize the way we deliver care, especially preventative care. So we are really looking forward to having that 360-degree view of the patient from the different data sources to be able to close care gaps and improve the way we outreach to patients and we deliver interventions. So the 2030 vision is focused on prevention before intervention, and it's about not the lifespan, but the number of years you live, but actually the health span and the quality of those years, especially as you get closer to end of life. So we think of a vibrant society of citizens that are engaged in both their health as well as in their community. So looking to improve that engagement. In Saudi Arabia, we have a lot of, similar to other parts of the world, chronic disease. Over 50% of our deaths are due to chronic disease. 20% of our patients live in outreached areas that we don't have access to, so it's very hard to get that information about them unless they're coming into a hospital for sick care. And our compounded annual growth rate for health spend is 10%. So looking at delivering a program for Saudi Arabia and for us in Johns Hopkins that encompasses that quadruple aim of Institute of Medicine, which is better quality of care for patients, patient satisfaction, clinician satisfaction, and as a byproduct, not the initial thing, realizing the value in care. So multiple things. So let's start from the patient side, right? For utilizing AI, I don't know if like a lot of people have those Fitbits or like this ring. This ring now through the coach actually provides personalized advice to me about when I need to move, personalized coaching on if something's going on, if it's detecting that my pulse rate availability has changed. So it's that personalized information that patients get, whether from the clinician, their wearables. For me as a clinician, it's providing also patients with that personalized information. So for example, if we have a patient who's on a wheelchair, and we have a gap because he's not moving and he's obese, we can't send just a general say, hey, you need to do 10,000 steps, right? We have to make sure that intervention is actually personalized to that patient. So it's looking at that. It's also for me as a clinician, being able to risk stratify my patients and see who needs my care the most so I can actually target my care to take care of them first. Who's at a risk of diabetes complication? Who's at a risk of being hospitalized or admitted to the emergency room? So it's being able to have that view, that 360-degree view for the patient for all that area. For me and my colleagues who are administrators, it's also knowing where to allocate our resources, right? So how are our interventions that we're doing, how successful are they? How is our risk? How's the risk of our population? Have we actually, we set out to do these great programs, have they actually resulted in true value for the patient? So it's being able to measure that. And how has our population's risk profile changed with these interventions? You can't control what you don't measure, and I will add to that, and you can't measure what you don't benchmark, right? So data is crux to all of this. And the problem is data in our systems in clinical systems is very fragmented. We only have a small, tiny view in our system because most of the care doesn't happen in the hospital. Most of the care happens at home, at work. So we're not very privy to a lot of that social data, social determinants of health, things that we're not able to collect directly because maybe the patient never comes to the hospital, right? So being able to collect data from multiple sources and having that 360-degree view of the patient, whether they were seen in our institution, seen in somewhere else, there's some information that flowed about some of the social determinants that comes in, helps us not only being able to risk stratify them and knowing what they're at risk to develop, but it also helps us personalize the intervention that goes. So population health needs a lot of data, but then when you ingest that data, of course, assuming that you have tools that within your hopefully a data warehouse and also processes within to make sure that data is clean. Once you have that data aggregated, you can utilize it for many things. There's so much you can do with it. It can feed in terms of AI and whether it's proactive care or preventative care, right? So whether you're using risk algorithms for risk, algorithms to stratify the patients or to produce those interventions, it's unlimited what you can do with it. I think the partnership is for us to co-develop the solution that fits the context, the way our data is in Saudi Arabia, and us being able to show value to our Saudi Aramco patients and all shareholders, and to Saudi Arabia as a whole, of how we can leverage the power of data, the power of technology and systems to hopefully move towards that vision of being an accountable care organization in which we're focusing not on the lifespan, but the health span and basically the qualities and the dollies. I would say it's the number of impacted lives that it will affect, right? So when we're doing things in clinical practice, you're affecting the lives of a small group of patients, right, or just one or two. But when you're doing this at scale, you're not only impacting your generation, but also generations to come. So I think just for me, being passionate about launching this and being on the forefront, starting off something like this really has me proud of hopefully what's to come from both our teams.